Rachel presented to me with pain in her back, but more notably had pain into her lower extremity, into her buttock, back of her leg, and down into her lower leg due to a herniated disc.
I'm not sure what I did. I had taught a training class at work and was on my feet most of the day, and I could barely move. I don't know what happened, if it was the standing, if I moved wrong in my sleep. I don't know what I did.
Rachel came to me with a herniated disc, and that is where the cushion that sits between the vertebrae is normally held in check by a ligament. For whatever reason, the ligament gets a little hole in it, and out under pressure comes a piece of disc that shoots out, hits the nerve, and it pushes it back against the bone. It has nowhere to go. So it's tremendous pressure. It's almost if I'm stepping on your toe with a boot. There's tremendous pressure on the nerve, and then the nerve then radiates the pain down the distribution of its course. In Rachel's case, we offered surgical intervention because she had progressive, persistent pain that was not going away with time, or oral steroids. Number two, she had a large disc fragment that actually had not only left its little home between the two vertebrae, part of it had broken off and was down behind the nerve. So we offered a surgical intervention where we go in and actually remove the herniated disc.
I spent one night in the hospital. The relief from the surgery was almost immediate. Within 30 minutes of waking up from the anesthesia, I was able to stand up and walk by myself. Rare that I find myself at ease with a doctor, and I was almost immediately completely at ease with Dr. Banister and his nurse Sherry. She's just great too. I really felt that he cared about me as a patient and wanted to help me get better. Today, after the surgery, I can move. I can bend over and pick up the dog. The ability to enjoy my life again, because I felt like I didn't have one before. Now I actually feel like getting out and doing things and talking to people.